right, good morning, everyone. It's so exciting to see such a full room of people who probably have just as much of an affinity for data and a little, shout out to the data nerds in the room. So thank you. So my name is Karen Austrian. I'm the director of the Girl Center here at Population Council. And it's been a pleasure over the past couple of months to prepare for this event with some of our colleagues. And I think what's so exciting is that, for us at Population Council, we do research and we generate evidence so that it can be used. So this event today really feels like at the crux of taking all of this data that's out there on adolescents and how do we package it and put it out there so that it can be used, both by program implementers, by policymakers, by young people driving change in their communities. So really excited to see all the creative tools that are going to be featured here today. We hope this will be an interactive and exciting, a practical, useful session. Before I introduce our keynote speaker, I just want to say a couple of housekeeping notes. So we hope you helped yourself to breakfast. If you get hungry, you can go outside and have some more to munch on. Population Council is this used to be our office, and we're in the process of moving down one floor, but we have been allowed to use this space. So all that means is that there is actually another company that really has nothing to do with UNGA at all that is working here today, and it's their office space, and they've asked that we not wander around the office. So if you're going to leave this room, please stay in the lobby and then just access the restrooms that are along this corridor. But please don't go any further than that. You will find nothing on data and adolescents anywhere else in this. So without further ado, I'm thrilled to introduce the brand new president of Population Council. I think she reminded us this is week 3. Dr. Rana Hajj, she is a medical doctor and epidemiologist by training, and most recently served as the Director of Program Management for the World Health Organization, Eastern Mediterranean Regional Office in Cairo, Egypt. She also served prior to that for 23 years at the U.S. Centers for Disease Control and Prevention, researching and leading responses to major epidemics across the world. We are thrilled to have her open our event today. So without further ado, Rana, please take us.
Thank you so much, Karen. Good morning, colleagues. Really lovely to have you, and I cannot think of a more fit event for us at the council to start UNGA with more than data. I love data. You're probably all wondering, what is an infectious disease doctor who's worked on epidemics doing here? Just because I'm a global health expert, because I've worked in developing countries, because I know the value of data and the value of strong science, epidemiologic science, and strong public health, and that's my main thing. But maybe before I get why I love data so much, I would just like to take a second to welcome you all here at this great event. I know you are all advocates like us for adolescents and young people rights. And very warm welcome. I hope the week is going well so far. I was going to say I brought with me from Cairo, where I was based, some warmth, because the weather has been amazing since I came to New York, but it's starting to change. I hope it will carry, my charm will carry for the rest of the week. But before starting, I would like first to acknowledge the contributions of our co-host organizations, Equal Measures 2030, UNICEF, and Data, as well as the council. We have 2 major innovation hubs that are a major part of this. Karen already introduced the BIRD Center, which I just want to highlight, as you will see in the small card. It's the BIRD Innovation Research and Lab, and also our GG initiative, which is Gender Education, Justice, and Equity Initiative. I cannot get over how cute these names are and how intuitive they are. They really, I think, very nice. There's a lot to be said in names, and I think they summarize well what we strongly believe in at the council and many of you. So as Karen mentioned, I joined the council actually exactly today, 23 weeks ago, and coming from from WHO, from a region that is really very much afflicted by conflict, by emergencies, by so many issues where the needs of girls in particular often get forgotten. So, and for us to be able to highlight why this is so important, I think data becomes even more and more critical. Already I'm trying to learn a lot about the Population Council. As you know, this is a 70-year-old organization with really long legacy, history in supporting women's health, women's rights and choices for sexual and reproductive health. And now more and more we are investing in adolescent girls and the whole spectrum of women's life. And I would like to point out, I was discussing with Karen yesterday, that our researchers were among the first to make the case for investing in adolescents to advance the global development agenda. So I really, and I'd like to recognize we have Judith Bruce here with us, one of our colleagues who was here for years, and she really introduced that whole agenda. This was more than 25 years ago, and now it's become a global agenda, and there's a lot of work still needed to fully outline the strategy and the global needs. So since then, we have built the world's largest body of evidence on what does and does not work, so that adolescents and young people can reach their full potentials. Of course, one of the lessons we learned is that for these programs to actually be meaningful and to work, the adolescents and the young people, the youth, need to be engaged themselves. We cannot just sit here and develop all of these strategies or programs without their involvement. Equally important is that they should be really active. They should be contributing meaningfully to these things, but also they should be supported. I remember at WHO when we started engaging youth, we would bring many of these representatives of youth organizations, and then I realized many of them, they were amazing people. I never, at their age, I never had that kind of exposure and insight, but they also need help. They need us to mentor them so that they can better represent their, all their friends and population of young people. Our partner and co-host Equal Measures 2030 recently released its 2024 SDG Center Index, which is an impactful tool that tracks 159 countries, covering 96% of the world's women and girls, quite impressive, on 56 gender equality issues that are aligned to 14 of the 17 SDGs. Among its findings, and which was really shocking and depressing, that no country is on track to reach the gender-related SDGs. No country. Most of the other SDGs, you would find that, there's a whole range of countries that will meet the goals, the targets by 2030. This should be a very strong wake-up call to the community of what are we doing. I actually feel, and coming back from the WHO again, where we have struggled a lot with gender issues lately, that we are going backwards and we are losing some of the gains that were made actually over the last 2 or 3 decades in gender equity and rights. And for us to close the gender gap between adolescent girls and boys, we cannot do that without data that really help us understand what are these gaps, what is driving them. And maybe what I would like, before getting to the event today and what it's highlighting, I would like to also say that we need, knowing how long it takes between collecting the data needed and the impact on policies and programs at country level, we need to start many years ago. That's why we started 25 years ago. It takes a long time to do that. Today is actually a very good day for me that I'd like to share with you, that I have a story to share. Today is my daughter's birthday. She turns September 24th, and she turns 34 today. Makes me look much older than I am. The reason I'm mentioning that, and linked to data, the delay between data and the policy, is my daughter HPV vaccine, which is now our best tool to protect women from cervical cancer, almost 99% effective. I mean, that's one of the best vaccines we have around. It was approved in the US. I was at CDC in 2005 by the Advisory Committee on Immunization Practices, ACIP, in 2005. My daughter received it just a year after, because she was a little bit afraid, and at the time she told me I'm not high risk yet. She was aware, but of course I didn't wait. The year, right, within a few months she got the vaccine, and soon after her brother, my son, also got the vaccine, even though at the time the recommendation was optional for boys. So this was almost 10 years ago. Okay, up till now, we still have many girls around the world that do not have access to HPV vaccines. One of the things that I was very excited about just before leaving Cairo, because Pakistan is one of our countries in the region, after years and years that I've been trying to convince them, they finally submitted an application to Gavi, the Global Alliance for Vaccine for HPV. And it was approved just a week I left Cairo. So 9 million girls every single year is the cohort of girls who will benefit from this vaccine in Pakistan. But it took 20 years to get to that point. 20 years of wasted opportunities for women who, for a cancer that is one of the most common. There was an article in the New York Times, I don't know if you saw it now, President Biden, who happens to be in town today, which is why all the traffic, now he has a major initiative for this. So anyway, but that's really to give you an idea about this delay, and that's why data is needed. One of the reasons Pakistan and many other countries did not introduce vaccines, they said we don't have data on disease burden. You know, of course, the data, you have to dig for the data, you have to go to the places where you can find it. That's why I think the work we are doing, all together to generate as much data as possible is really critical, but we need to anticipate the needs. We don't have to wait on someone to tell us. We know what is needed. We are always there. We are on the ground. We are in the countries. We talk to the policymakers. Some of them, it might take them time to realize that there is need, but we can anticipate some of the needs, and we need to anticipate some of these needs and be able to generate them. So today's event highlights some of the fundamental best practices in generating such data for adolescents, and especially the data that we need to impact and policies. So, of course, the data for all, as I mentioned, data plays and evidence plays a very crucial role in shaping investment programs and policies. Without the data, it's very hard to make strong evidence-based policies, especially when there is huge financial cost associated with it. So I think data will drive the important policies, and we need to also make sure that the data that we generate is translated into the right policy. So our work, that's why at the council, our motto, here somewhere, so it's ideas, evidence, impact. That's actually part of our, our title, ideas. We generate the ideas, we develop the evidence, and then we work on it to make sure it translates to impacts. And of course, putting the adolescents and youth in front center to generate the data is really important, as we discussed. And you have all been already part of the Summit of the Future, as you know, between the UNGA and Summit of the Future, the Population Council, we continue the commitment to generate and disseminate the data to inform, these meaningful investments, and also to keep up with the aspirations of achieving gender equality and well-being of girls and young women everywhere. We are using our data platform to catalyze multi-stakeholders, partnership, investments, and actions. And again, not to end with this, but I would like to highlight that there are certain contexts where data are highly needed, like, for example, in emergency and humanitarian situations. Again, coming from a region where, usually priority is safety, food, and shelter, sometimes, girls' needs get really forgotten. And so last but not least, not to make it too long for you, really welcome, very warm welcome. Thank you for being here early in the morning. Thank you for all your insights. Thank you for your partnership. And I hope you will find this event very useful, that the discussion is stimulating. And I'd like to thank, Karen and the whole team we have here at the council with all of our partners to have put this thing together. So thank you.
Thank you, Dr. Rana. Asante sana. Swahili for thank you. My name is Evelyn Karijo. I'm the Associate Director for Policy, Partnerships and Engagement at the Pearl Center. And it's my honor to now lead us through the next segment. Very exciting because we'll have presentations from esteemed experts who have led and contributed to the design and development of global platforms for adolescent data and evidence. We will start with Julissa Sambanan, Deputy Executive Director and Head of Partnerships and Learning at Equal Measures 2030. I'll just briefly read her profile. Julissa is a gender justice activist with nearly 2 decades of experience in adolescent growth and protection programming. Equal Measures 2030 is a global feminist coalition connecting data with advocacy to advance gender equality. Julissa co-founded Girls First, promoting girl-centered design, and has worked with organizations like Malala Fund and UNICEF, an Obama Foundation leader for Asia Pacific. They've worked across Asia and Africa, committed to social change, accountability, and inclusion. Please welcome Julissa.
Thanks, Evelyn. Hi, everyone. Good morning. Thanks for being here. My name is Julissa Sambanan, as you see. I'm not used to have my photo that big. But I'm going to talk to you a little bit more about Equal Measures 2030 and our new SDG Gender Index. My colleague here, Albert Motivans and Arushi Khanna, will be able to share with you about our findings in our station. But just a little bit about Equal Measures, as Evelyn mentioned, we are a coalition that connects data and advocacy, data and evidence with advocacy and action to achieve gender equality. So one of our mission is to share data with advocates, to make it accessible, to make it applicable. And so we launched this 2024 SDG Gender Index just earlier this month. It's basically the most comprehensive global gender equality index with the SDG. Thank you, Dr. Rana, for the shout out. And it's out earlier this month. It's a multi-dimensional index, so benchmarking gender equality across 199 countries, covering 96% of world women and girls. And it also has 56 indicators across 14 of the 17 Sustainable Development Goals. So there's a lot of global indices in the world, and there's CIPI, there's the World Economic Forum Index. But this index is different in several ways. So our gender index aligns with the SDGs, and we chose SDGs as an entry point because almost 200 countries signed up to it. So it's an easy, not easy, but like it's a way to hold power holders accountable. So that's one, and then it covers quite a range of indicators. We've got adolescent focus indicators. It's not focusing only on adolescents, but on issues affecting women and girls. So there are gender-related law attributes and outcomes from national scientific offices, opinion polls. So that's one thing that makes our index different. We have perception data, so really what women and girls think about infrastructure in their country, about safety in their country, example. And it covers more women and girls than a lot of other indices. So 199 countries and more than 96% of the world's women and girls. It provides the biggest picture, right? So context is really important. When we work on adolescent girls, we have data on adolescent girls, but we also really need to think about the context around them. So the index provides that. It also provides sufficient and consistent data. So we launched our index 3 times, 2015, 2019, and right now. So we benchmarked it. So we look at countries' progress every couple of years to see how fast they are moving to achieve gender equality. And it's audited, so we have transparent methodology, because I know you're all data people, you're like, is this legal? So yes, it's been audited. And then I think one of the things that makes me really proud about this index is co-developed with gender equality Equality After the Coalition. So the indicators have been looked at, reviewed, and suggested by feminist advocates, basically. So we've got coalition members working on national level, regional level, and global level, looking at this index and then making sure that it's really relevant and they can use it. So you won't be able to see in the small print here, but this is basically the findings of the index. You could see ranking of countries, but we encourage you to look at beyond that. So it's not just ranking that we're really would like people to see, what sort of my country's ranking, but really thinking about the pace of change, because as I mentioned, we've got 3 different benchmarks. So we can see there are countries that are making really good progress, fast progress on several indicators. There are countries that are stagnating, there are countries that are declining. So as Soprana mentioned, no country is going to achieve gender equality by 2030. And if we are following the pace of the countries that are declining, we will have the worse than 2015 when the SDGs was presented. So that's really troubling finding. So based on current trends, if we are, so we've got 3 benchmarks here, and these are the score that we gave the world. Basically, right now we're 66.1. It's a very slow pace from the previous index. So with this pace right now, a global today will have to wait until the 97th birthday to see the world reach gender equality. So I will not be around anymore. So, but even that may be optimistic, right? So what I said earlier, you have to really think about the pace of change. If we're going slower than that, with the rollbacks, with authoritarian governments that are really attacking gender equality, then we might be worse in 2030 than 2050. Again, so there are, nearly 40 countries exciting, so that's not a really far-fetched scenario. The number of countries in real decline in the situation for women was jumped since 2019. And so the reason why we track over 14 out of 17 SDGs, we were not really focusing on UN SDG 5, like, there is a gender equality goal in the SDGs, but to achieve the SDGs stuff, we really need to look at gender equality on every single goal. So you can see nearly 3/4 of the SDGs that target are directly or significantly reliant on gender equality. So it's really important to look at the data that way. Again, very quickly, these indexes basically just provides a big picture. So you will be able in our station later to play around comparing indicators, comparing countries, comparing goals to see where we can, where progress are being made and lack thereof. And this is a very shocking finding from our index. You can see, like in the beginning, the world map that I showed you, countries are scored based on very poor, okay, or good, and very good, and very good. Index only one country has a very good score in our index, which is Switzerland. But nearly 75% of adolescent girls and young women live in countries with poor and very poor on the index. And that's also very troubling. And very quickly as well on the adolescent focus indicators, visualize some indicators that on girls and young women. We see some progress, but really slow. So you can see it's really good to see early forced marriage are changing really quickly from 2019 to 2022, but you can also say we have better data now. So it's not because it's fast, it's because we have better data, which is great, but I think we also need to be very careful about reading the increase. So you can see the really slow progress for those schools like expectancy, for example, which is SDG 4, and young women and youth. So it's really troubling if you see the progress that way. You can see the world is improving, but it's very slow. So on our website, the index is free. You can download it. You can play around with it. our coalition is trying to make it as useful as possible for advocates and practitioners. So there are interactive data visualization on our website, and then you can play around in our station as well later to see how to do that. But first and foremost, because this index is built by advocates, we want it to be used for advocacy support, accountability, informed policymaking, and resource allocation. So it's not just, like obviously it's great to see the data, but really what it's for is for advocacy to inform policymaking. And based on, this is my last slide. So based on all of the things that, of the findings of the index, we also, our coalition also came up with 7 recommendations for governments, for policymakers. One of them is really recognize and respond to the unique needs and life stage of adolescent girls and young women, because I think you can be better in collecting data around adolescent girls, right? A lot of data are not age disaggregated, so it's really important to when we improve our data collection, then we will be able to inform policymaking there as well. So thank you, and I am looking forward to speaking with you more in our station, but I'm happy to back over to everyone.
Indeed, very inspiring and a wake-up call to all of us. I know most of you have questions, and we'll get time for that during the breakout session. Of course, we have a number of speakers, so we'll take 5 minutes for each of the speakers, so we have time for the breakout session. Our next speaker is Meredith Kozak, Program Manager, Gender Education, Justice, and Equity Initiative at the Council. With over 8 years of experience, Meredith is dedicated to advancing gender equity in education. As a co-creator and manager of the Evidence for Gender and Education resource, Meredith has been instrumental in creating interactive digital tools that empower researchers and policymakers to address global gender inequalities in education. Her research focus is on identifying the alignments and misalignments between the needs, evidence, and practice in the gender and education sector, and translating these findings into actionable recommendations for gender and education proposals. Very exciting. Please welcome Meredith.
Hi, everyone. Good morning. Thank you, Evelyn. It's a pleasure to be with you here this morning. As Evelyn mentioned, my name is Meredith Kozak, and I am the program manager of GG, or the Gender Education, Justice, and Equity Innovation Hub here at the Council. And I'm really excited to share with you one of our innovative resources in the GG program, the Evidence for Gender and Education resource, or better known as EAGER. So what is EAGER exactly outside of a really great acronym? EAGER is a program of work and an online resource that seeks to address gender inequalities and injustices within global education. By providing easily accessible data and evidence, we support the gender and education community as a knowledge partner. And we inform programs and policies that also shape the global agenda. And we do this through 3 main activity areas. First and foremost, we generate and synthesize evidence through the creation of various research publications and mapping current gender and education programs. Currently, we've mapped over 700 organizations and over 1,000 programs currently active in the gender and education space. We also translate our evidence in more digestible formats for a variety of stakeholders by creating briefs, reports, and other interactive data visualizations and compelling communications. And lastly, we build partnerships in collaboration with advocates, donors, practitioners, and others to ensure that we're responsive to the field's most pressing gender and education questions, and to ensure that we're creating pathways for evidence uptake. However, EAGER isn't just a data site. We synthesize and connect the dots within gender and education. Through EAGER's innovative needs, evidence, and practice framework, we explore and juxtapose where needs are greatest, what's being done in the gender and education space, and where needs are greatest within this field. In essence, we aim to highlight where there's alignment and critically where there are gaps to ensure that limited resources are invested in the most promising and effective approaches to reduce gender inequality and improve learning outcomes for all children. Each aspect of the eager web portal aims to provide easy, accessible data and evidence that address each of these three pillars here, and we bring all of those pillars together within the web portal. But one of the most visited parts of the eager website, and to start us off, is the eager practice database, where we've compiled information on over 700 organizations that are currently working in the gender and education space, and over 1,000 programs that focus on gender and education. Through easy-to-read organization, program, and country profiles, our database documents who is in the gender and education ecosystem, what are they implementing, what programs are they implementing, and what context are they working in. And while the profiles provide an individualized view of programs and organizations, we also have a map builder tool that allows you to see the gender and education space from a bird's eye view. And while the eager database documents who is doing what in the gender and education space, our Power Numbers tool focuses a gender lens on education data to drive equity, and it also highlights where the greatest needs in education, gender and education are. It's comprised of two core components, downloadable data stories and an interactive and sortable data table, so users can quickly survey the current state of gender and education in low and middle income countries. Power Numbers was designed to allow users to easily copy and incorporate compelling gender and education facts into their own reports, social media, investment cases, as well as other materials as well. And we also use a myth fact format to help users see the implications of the data as well. But bringing together both our needs and our practice within our Venn diagram, we have created the Global Accountability Dashboard. And so citing eager as a central resource in the gender and education field, UNESCO and the Global Platform for Gender Equality and Girls and Women's Empowerment in and through Education has asked us to co-create the Global Accountability Dashboard. And this dashboard monitors progress on key indicators on gender transformative education, drawn from the call to action from the Transforming Education Summit. The dashboard brings together data as well as case studies from a wide range of partners, including governments, donors, and civil society organizations. And the ultimate goal of this dashboard is to propel transformative action on gender equality in and through education. And lastly, but definitely not least, eager houses evidence on what works to improve education outcomes for all children. Users can peruse our briefs, reports, blogs, and webinars, as well as our evidence to practice tool to gain insights into the most promising or effective approaches to reduce gender-related barriers to education, and identify where the gaps still remain within the evidence base as well. One of the resources that I would really love to highlight that brings all of our aspects of our needs, evidence, and practice together within the eager web portal is our Girls Education Roadmap. And the roadmap is a first of its kind report that analyzes SDG indicator data. It pulls evidence insights from one of our systematic reviews on gender-related barriers to education, and it synthesizes data from the hundreds of programs that are in the eager database to identify who's doing what in this space, what's working where, and where are the greatest needs within gender and education. And so we can come together to identify opportunities and gaps so we can invest in the resources and where it's needed most. So in a nutshell, eager is a free and interactive database where we collect, analyze, and curate the latest data and evidence on gender and education by profiling who is doing what in the gender and education space, what is working where, and what are the biggest needs within the field. And so with that, I thank you so much. I'm looking forward to meeting all of you at our station during the breakout session. Thank you.
And I like how all these data platforms are interconnected, so very exciting, and we look forward to the breakout session. Our next presenter is Renee Nevarez, Research Associate at the Population Council, and he's come all the way from Mexico City. Renee is a sociologist with a master's in cultural studies, specialized in gender and power. He's the lead for the Adolescent-centered for Action that we'll be talking about. And before he joined the council, he coordinated the survey of migration in the northern border of Mexico and the Mexican health and aging study. He's also the coordinator of the VOCES study, an online regional survey in Latin America focused on adolescents and young adults. His research areas are youth, climate, and migration with a special interest in data visualization. He's very good at that, and yeah, we can take for the breakout session, but now for the presentation.
coming. It's great to have you here and have this discussion. And I think it's the next step for data usage and be able to provide non-data specialists resources and tools to understand data, right? So sometimes a spreadsheet can be overwhelming, and being a data set is just sometimes a little boring. So with that introduction, thank you to the presenters, Evelyn and Lisa. I think that was a good way to talk about getting data accessible to non-research specialists. And this is the Adolescent Atlas for Action, also known as the A3. And that is developed by the Girl Center with in-house team and also with other developers worldwide. It was first launched in 2021, and it started off sort of as, where is data on adolescents available? And the first tool that was developed by the council was the Adolescent Data Hub, which compiles over 700 data sets across the world to have data accessible. But then we asked, what can we do with that data, right? So we started developing the data visualization tools to be able to reach policymakers, advocates, implementers, funders, and researchers as well. Sometimes when you have a report, we do research, we end up with a 98-page report, and then policymakers want to shrink it to 1 page, right? Because they don't have time, they need the specific data. So that's something that we want to do with the adolescent indicators, which is provide just a large repository of data into visualizations that are interactive, easy to understand, and to navigate. And beyond data, we also got a list of 56 indicators on policy indicators across the world. And we also have our policy checklist. So these are our 6 visualizations. It's the adolescent indicators, the policy checklist, the adolescent migration dashboard, gender gaps, which was beyond knowing what are the conditions of girls and boys across the world. We want to know what those differences and how those compare. And the adolescent data that I mentioned. And just this month, we have a new dashboard, which is sort of a different format of dashboard. It's called storytelling. If you're familiar with this, I don't know to the part here, but where as you navigate, it tells the story of data. And we did that in alliance with the World Bank on the African Adolescent Girls Reports, which is the idea of building bridges for girls. And so how is this organized? The first 3 here that you see are the indicators for gender gaps and the policy checklist. Those are all merged into one visualization that you navigate differently with 9 indicators. And of course, this is one of the main issues with data across the world. They are not equally available in all countries. So we tried as hard as we could to get these domains for all countries across the world, but we couldn't. So some of these are just for specific countries, specific boys, specific girls. And they are mostly from the PHS and the mixed surveys, which are standardized and they're comparable across countries, which was something important for us to consider. And the policies we have just actually updated these from websites and from official sources, because these are also not just readily available for everybody. And the most recent ones were last year we implemented the adolescent migration, which is from micro data from censuses across the world, and we use the IPOMS data. And this presentation might be a little boring, but I promise the dashboards are great. And then recently, the African Adolescent Growth Report, which is storytelling, and this is again from DHS with collaboration from the World Bank. But here's the new piece. If you've been to the site, it's good, it's fun. We've done this site in 4 languages. So it's now in English, Spanish, French, and Portuguese, targeting LMIC countries. So that's also available. And the newest addition is now if you don't have time, you're a policymaker that you don't have time for a dashboard, we've implemented the in-house developing team an AI assistant that will explore the data for you. And it's in its beta stage. That means you have to speak with it with precise questions, because if not, it will just tell you something else. That's how AI works. It's learning to answer questions. The example I have here is I have different ways of asking, do boys in Mali smoke? How many boys in Mali smoke? What's the prevalence of smoking for boys in Mali? All those questions, the model will be able to answer that same question. It depends on how you ask it, but it's still, like I said, in the beta stage. So if you ask, what is gender? It's, it's going to tell you, I don't know what, that's not what I'm graded for, but please ask for help. And if you ask it for help, it will tell you the list of indicators that are on the dashboard. And we are really, really excited about this tool. It's also part of the resources that the council is trying to build on with AI and access to data more friendly, human way. And so please visit our site, and I'm sure you will have more questions for us in the breakout session. So thank you.
Thank you, Renee. Very exciting topic to dive into the data and see how that AI works. Our next speaker is from UNICEF. I just want to confirm that Colleen, yes, thank you, Colleen. Colleen Immerse, statistics specialist, child protection at UNICEF. Colleen is responsible for global monitoring of harmful practices and adolescent well-being. Her work on adolescents focuses on development of emerging measurement areas, including civic engagement and participation. Her work on harmful practices focuses on analyzing levels, trends, and disparities in child marriage and female genital mutilation, including for global reporting on progress towards international targets, such as the elimination of harmful practices as set out in the SDGs. Colleen Murray from UNICEF. Welcome.
Thank you so much for having me here. I'm excited to share with you a platform that we developed a couple of years ago that's called the Adolescent Data Portal. So I'm here on behalf of UNICEF's data and analytics team based in our headquarters in New York. And as many of you will know, UNICEF's mandate includes global monitoring of the well-being of children. So this is done in part through its role as custodian agency for 19 child-related sustainable development goal indicators. And those represent a pretty small sliver of the data that are regularly collected and then compiled, validated, analyzed, and reported by UNICEF. So speaking of this kind of global monitoring framework, it's helpful, I think, to situate us and think about what type of data are we talking about when we look at different types of tools. So here, what I'm presenting today is data that's used for global monitoring. So the data that we're talking about are nationally representative, internationally comparable data that describe the prevalence of issues affecting children, including their access to services, their overall well-being. They are collected by national governments, aligned with international standards, and are carefully validated for when they're used in UNICEF global databases. So while there are some limitations in terms of the topics that are covered, and in some cases in terms of timeliness and availability across countries, the strengths of this type of data is that they are generally high quality, nationally owned, and can be pretty reliably used to draw conclusions about the situation of adolescents at the population level. So we'll see some of the topics that are covered in the UNICEF global databases, but they span a broad range of areas of well-being that include education, health, transition to work, and protection from violence and exploitation. I'll also very quickly touch on some new and exciting areas of measurement. So the aim of the Adolescent Data Portal, as this year, was to bring together data on adolescent well-being all in one place in a platform that's easy to use. So put relevant data in the hands of those working with and for adolescents. The goal was really to respond to a need that we often heard from colleagues and from partners, that they struggle to understand the situation and needs of adolescents due to a lack of data. So this platform doesn't provide more data, but it brings together the data that exists in one place. So again, while there are certainly gaps, the platform was really meant to make sure that the data we do have are in the hands of those who want to use it. So the portal, when we were designing it, we're thinking about meeting the needs of a few different types of users or levels of users. So we have kind of in a very simple, easy to read way, we have these data-driven narratives on adolescent well-being that are designed for a general audience. So if you want to read a paragraph about adolescent education globally and get some key numbers, that's there for you. We also have interactive data visualizations for people who really just want to play. Like they want to click around, they want to compare, they want to see trends over time, they want to see what's available, what's not available. Okay, so that's there for that type of user. And then we have country profiles and database downloads for people who come to the site with a focused interest and want to answer a certain question. So again, the content of the adolescent data portal, it features a selection of key indicators that are closely tied to the Sustainable Development Goals. They cover areas of health and nutrition, education and learning, protection, and transition to work. So there's a selection of about 5 indicators or so in each one of these domains of well-being. We also include some data on the context in which adolescents live through measures like poverty and access to water and sanitation. These are not adolescent-specific measures. They're not available really at the moment, but also things like demographic data, just the basic context that adolescents are living in is provided as well. While we don't yet have the data, we have a kind of fifth pillar of adolescent well-being, which is adolescent participation and empowerment. It's also featured in the site as an important area of measurement, and talk about that in a little bit. We are holding space for it, even though data are not yet available. And then lastly, one of the more recent developments that we've added to the adolescent data portal is increasing focus on adolescent girls and the importance of gender during this period. So we have sex disaggregated data throughout, as well as some newly developed adolescent girl profiles that really focus on the situation of girls and the gaps between girls and boys. So again, the website, and we look forward to having you all click through and come visit us and see what's there that meets your needs. But just a quick overview, I can say that the website features what we call snapshots. These are those thematic overviews by topic that kind of walk you through the bird's eye view of findings. We have country profiles, both overall country profiles on adolescent well-being that cover those 5 areas, as well as the adolescent girl profiles as a separate standalone product. You can look at each of those. Have this data visualization, kind of exploratory one where you can look at trends, you can look at maps, you can compare countries to each other. You can see what types of disaggregation are available in the data. And then we have data sets available where you can just download and take it for your own use, as well as an overview of data availability, which sometimes can be useful depending on your purposes to really show that there are gaps and they could differ across topic and across. The adolescent data portal lives within the UNICEF data ecosystem. So you can find us at data.unicef.org/ADP, and you can use either the URL or QR code that you'll see over here. A couple things to note about what's coming next in this area. We would like to further develop the adolescent data portal with a few more features as funding allows in this tight space. But one of the next things that we're looking to incorporate is more inclusive view of data, so including additional disaggregations by adolescent disability status, which is information that's increasingly becoming available through survey data. And as I said, we also are working on some new areas of measurement around adolescent participation, civic engagement, and empowerment. So we hold space in the site to kind of talk about what that measurement first looks like. At the moment, we have a tool that's in field testing and hopefully will be coming soon. I see some familiar faces in the room who've been involved from the outset in this effort to really get measures of adolescent participation and empowerment. It's been a long road. It's a tricky thing. While I have your attention, I also wanted to take this moment to highlight a couple of other resources that UNICEF data has to offer. The Adolescent Data Portal, again, was designed to give this sort of bird's eye view of different areas of well-being across that, within that age group. But there are, on pages@unicef.org, you can find a number of other resources that are more focused by topic. There's an adolescent health dashboard, which has profiles by country and by region, that really does a much deeper dive into health and what we offer in the ADP. Also recently launched the Child Marriage Data Portal, which I can show you over at the table, which is really focused on child marriage and progress towards meeting that SDG. And again, there's data on other topics, more on education, more on mental health, exposure to violence. So there's a lot we can find data.org. Thank you, and I look forward to seeing you.
Thank you, Pauline. We can't wait for the new tool that you're developing. We have just one more presentation before we get into the very interactive sessions with each of the experts. So please bear with us. This is one presentation that's actually very unique because it's all about designing platforms with girls, ensuring that their unique perspectives and needs are addressed. So I want to welcome Flora Mushiri, Communications and Advocacy Lead at Akili Dada. She came all the way from Kenya. Flora has a proven track record of empowering adolescent girls and young women, particularly in the area of sexual and reproductive health and rights. Flora has spearheaded strategic communications efforts to advocate for young women's access to education, reproductive health services, and ending gender-based violence. Her work is centered on amplifying the voices of marginalized girls, creating platforms for their stories to be heard, and driving action to ensure they have access to critical resources and information. Very exciting. Please welcome Flora.
Thank you so much, Evelyn. I think coming after lots of data people as a storyteller is really a bit overwhelming, but I've really tried to make it a little bit interesting. So a lot of data has been shared here, but I'm here to share two learning platforms that as Akili Dada, whom we are a leadership incubator, that really believes young women and adolescent girls can and do need and really need to be part of decision-making spaces. So for us, our really motto is to say that adolescent girls and young women really do have the solutions. We cannot be sitting on the table and deciding that what the problem is, the solution is this for them. They know their problems and thus they know their solutions. So I'll introduce our first digital platform, which is the Chinyambui podcast. And this is a fun, unscripted, insightful podcast led by young women. And in this podcast, it's really conversations around taboo topics coming from GBV, SRHR, that are primarily not conversations that you have with either your mother, for instance, or your auntie. So where you want to speak to other girls and really converse with them and ask them, or what are you going through in your life and how have you been able to navigate it? So this is really where the Chinyambui podcast comes in. And since its debut in 2021, we've been able to do 80 episodes with 4,405 global downloads, cutting across. If you look at the map, we've got Africa, Europe, North America, South America, and Oceania. So if you look at it, it's not only primarily a podcast that is only African-based, but it's a podcast that really relates to issues that girls and young women are really going through globally. And you take a look at the top episodes that really have been, had the top episodes in the podcast, you realize SRHR is really still primarily a huge topic. So conversations that really cannot be had are what girls and young women really want to, have conversations around by themselves and really get that insight from each other. So you see the sex lives of African women, which is a book review, because we also do that. Then we've got contraception, which is a taboo topic that I think if you are a girl, you definitely cannot talk to your, well, I'll speak for myself, I definitely cannot talk to anyone about it. So you'll get some of this information from the young women that lead the podcast. But sex education, menstrual hygiene, and power. So the podcast in itself just really aims to empower young women in the spaces that they are, in the conversations that really cannot have with anyone. This is what the podcast does. And because New York is quite busy and you need something to listen to when you're in traffic or walking into time to listen to the podcast, also the podcast is available on Apple Podcasts, Spotify. Just search Chini Ambuyu and you'll be able to have a listen to maybe one or more than one episode. And the other learning platform that we are currently developing is Anti-Salama, which translates to Safe Anti. And this is primarily a learning platform designed specifically for adolescent girls and young women. And it's going to be delivered through WhatsApp as a platform. I'm pretty sure everyone here in the room has WhatsApp, right? Exactly. So the reason why we chose WhatsApp is it's one of those tools that every girl or every young woman is on, either chatting to their friends or chatting to somebody special or their family member. So the features of this bot will really be privacy. We all know that when you're trying to access sexual reproductive health, privacy is really a concern. You cannot walk into a clinic or into a facility and say that you want to access either information on contraceptives, safe sex. That is really a hindrance. So what we want is to just offer a learning platform where girls can just come in and just get that information. Yes, Google is there, great, but with the information and this controlling information that's available on the internet, we want to kind of carve that niche information into something that is really credible, age appropriate, and really safe for young women and girls. And also we want really to combat the widespread myth around, contraceptions, menstrual health, safe sex, and abuse and harassment. So that's what primarily the board will be focusing to do. So the rollout plan for Salama really is currently phase 1, which is to have it in Kenya, and then slowly during phase 2, expand it globally so that it's more accessible to girls and young women in the world. Then, so when it comes to co-designing the platform, I must say, when we sat down initially and came up with a board, we really made it a really text-heavy board in such that it just was very boring. So what we did is invite a focus group discussion with girls, some of our alumni that we work with, and then we sat them down and ran them to the board, allowed them to interact with it during the piloting session. And you don't believe that when you think you've created something so fantastic, you're told actually it's really rubbish. So what they asked us to do is use emojis and visuals that it can be more interesting. We all know every time you're probably writing a text to someone on your phone, you probably give you a hint for emojis. So you say hi and it gives you the hi. So those kind of prompts is what we found that are very interesting to girls to interact with because it makes them more kind of like it's a funky thing with the Gen Z that I'm really hoping that the bot will serve. Then include age appropriate content. What do I mean? Now, how we did the bot is it has under 18 and over 18. So we have menstrual health, which was under 18, and then we've got safe sex, abuse and harassment, and contraceptives, which is for over 18. Now, when we were doing the piloting, the girls were like, when you tell me initially when I come into the board, these are the topics that I'm able to access, and then you ask me my age, and then you shut me up from the content, I'll go to Google. And I'll get all the information that I want that you're telling me that I'm not able to access. So our kind of goal right now is to have it to ensure that we're providing age-appropriate content on safe sex, contraceptives, and abuse and harassment, not just chatting about the under 18s or the board. Then also make the board inclusive by adding an audio feature. Again, disability inclusive is really one of those topics that really stand out. By imagining or assuming that because you can read, you need to also hear. So we were called out for making sure that the board is really inclusive by the girls and say, add an audio. If I just want to listen like a podcast, come on, I should be able to listen to the answers that the board is really providing to me. So that's how we really are now for designing the board in this, let's say in the next stage, then we'll be able to launch it now to everyone else. So what does the picture look like? So both the Anti-Salama and Chinyambunu podcast are really working to provide adolescent girls and young women with platforms to share stories, access critical information, and make informed decisions for themselves about their health. Again, they know what they want. We can never and will not be able to make the decisions for themselves. So with our commitment just to advancing feminist narratives, these platforms will continue to grow and impact even more adolescent girls and young women globally. And with that, I will not have a breakout room, but please do engage me on the podcast and also the Anti-Salama chapter. Thank you.